Every year, more than 250,000 children and adolescents are diagnosed with cancer worldwide. Nearly 80% of children in Europe now survive cancer thanks to better treatments. However, the treatments are harsh and can cause serious side effects later in life, which can reduce survivors' quality of life. For example, treatment with certain cancer drugs can cause hearing loss or make it more difficult for survivors to have children when they are adults. PanCareLIFE is a European-funded research project looking at hearing, fertility, and quality of life impairment in childhood cancer survivors. Our goal is to help ensure that survivors of childhood cancer enjoy the same quality of life and opportunities as their peers. Working with survivors and their families, doctors, hospitals, universities, and cancer registries across Europe, information from over 12,000 childhood cancer survivors will be collected in a central data center. We will use the information to study genetic and non-genetic risk factors for fertility, hearing, and quality of life impairment. We will also look at ways to educate patients and their parents about fertility preservation and develop international clinical guidelines for fertility preservation to help doctors and patients make the best choices. We will share what we learn with survivors and their families, doctors, other cancer researchers, and health policymakers to help improve childhood cancer treatments and follow-up care in the future. For survivors and families, we will engage with parent and survivor organizations using brochures and flyers and conferences. We will reach doctors and cancer researchers through publications, conferences, and clinical guidelines. And we'll reach health policymakers through our recommendations and guidelines. To learn more about PanCareLIFE, visit us on the web or join us on social media.